On the anniversary of the Disability Discrimination Act, I have to say it's disappointing to note that there wasn't much in the King's speech that actually delivered for disabled people. And after 13 years of Conservative-led governments, disabled people feel they're an afterthought and that their rights are not fully protected and promoted in this country. It is frankly shocking that we are still having these conversations in 2023. Progress has gone backwards, not forwards. And it's well documented that the pandemic and the cost of living crisis has had a disproportionate effect on disabled people. And this is on top of the fact that there already exists extra costs associated with having a disability. Earlier this year, disability equality charity Scope released updated research on the extra costs associated with having a disability, the so-called disability price tag. Now, when Scope last calculated the price tag in 2019, it stood at an average of £583 per month for households with at least one disabled person. Over the last 4 years, it has risen to a shocking £975 per month, equivalent to 63% of household income. This means that disabled households need to find almost £12,000 extra per year to achieve the same living standards as non-disabled households. The impact of these rising costs is further exacerbated by the fact that disabled people also tend to have lower than average incomes. In its January 2023 report, the Resolution Foundation found that the gap in household income between adults with and without a disability was around 30%, including disability benefits, and 44% excluding them. And ministers tell us they have brought forth a number of measures to improve disabled people's rights and tackle the barriers they continue to face. So let's have a look at some of them in turn. First, the National Disability Strategy. Announced in the 2019 Queen's Speech, the strategy was much delayed before its eventual publication in the summer recess of 2021. Now, whilst claiming to be bold, it introduced little in the way of new policy for disabled people, instead relying on other pieces of government work. Then it was held up by a lengthy court case brought by disabled people who disputed whether or not the consultation process had been lawful. And I would suggest that had the government engaged in proper co-production, the court case would not have been necessary. So next came the Disability Action Plan, which was quietly announced in December last year. And after months of waiting, the proposals for the plan were published in the summer recess again, and the consultation closed a month ago. And disappointingly, it does not contain a cohesive set of actions to bring about the changes disabled people so desperately need. And thirdly, we have the Health and Disability White Paper, which sets some plans to reform employment support and disability benefits. The most significant proposal, the scrapping of the work capability assessment. And this has left many concerned that the system will rely solely on the flawed PIP assessment. Now, all of this should be considered in the context of the United Nations Convention on the Rights of Persons with Disabilities, which seeks to ensure that disabled people's rights are promoted and protected. Now, in 2016, an investigation found that, and I quote, grave or systemic violations of disabled people's rights had taken place because of welfare reforms in the UK since 2010. Now, at the first periodic review in 2017, the Conservative government was judged to have taken insufficient action to implement earlier recommendations. Now, the next review is ongoing, but the Minister for Disabled People, Health and Work, who I know was on the front bench earlier and I would have wished to have been here now, caused further concern by refusing to attend an evidence session in August 2023. The government must do better. With 24% of the UK population identifying as being disabled, we must stop letting them down. We must break down the barriers that exist in society. And ministers should be taking every opportunity they can to co-produce policy with disabled people, because they are the experts by experience and ensure that their needs are being met in every part of life.
Yeah.